Hi, welcome back to another 10 top 100 drugs. Let's get started. So we have first on the list, we have Pepcid, and Pepcid is the brand name for famotidine. Some people say famotidine, either one's right. And Pepcid is a medication used to lower the acid in your stomach. It's available as a prescription and over the counter. It is for acid reflux, gastroesophageal reflux disease, GERD, and peptic ulcers. And that's when you have a wound basically in your stomach lining. And it is a histamine H2 receptor antagonist, which technically it's an antihistamine, but we don't consider it an antihistamine because I think that would be too confusing. But it is H2, where like Claritin, the other antihistamines that you would be thinking of, are H1. So it blocks the histamine receptors that are specifically in the stomach to reduce acid production. It's well tolerated, has few side effects, few interactions compared to proton pump inhibitors like Prilosec and Nexium. So this is my go-to one. I love that I can get it over the counter in 10 and 20 milligrams. I don't really need it. It's not expensive. I can get a prescription for 20 or 40 milligrams, but well, my doctor doesn't order it for me, so I can't, but I like to use this when I'm having a stomach issue going on for a couple days, and I don't have the malabsorption issues that I worry about with the PPIs. So fun fact, it can lower uric acid levels in folks who have high uric acid levels, and that is a characteristic of having gout. So it's actually, not many people know this, but it's a fun fact that I found. So thought I'd share that with you. All right, next we have a cholesterol medication called Tricor. Not a statin. It is in the fibrate class, and in fact, it's called fenofibrate. It's used for elevated triglycerides and mixed dyslipidemia specifically. Doesn't really work as well as a statin, but if a patient can't tolerate a statin, like a atorvastatin or lovastatin, and they've had muscle pain from it, they will usually be put on this. Another reason the patient might get this is because it reduces triglycerides. So in the cholesterol test, there's 4 things. There's HDL, LDL, triglycerides, and total cholesterol. And the triglycerides, this does a great job with that. So if that seems to be their only problem, the doctor might put them on this. It also will increase the HDL, which is called the good cholesterol, and that's the one that's sort of an indicator if it's that substance that's helping to remove cholesterol. So it does really well with that, and sometimes the doctor will actually just add it on because they need to add it on, but they don't want to go any higher with the statin dose. Still have to monitor liver and kidney function. Should be taken with a meal as well. So let's move on to Flomax. Flomax is the brand name for tamsulosin. Tamsulosin's primary use, and I'm going to tell you an off-label use in a moment. Primary use is for BPH, and that's benign prostatic hyperplasia, which is an enlarged prostate. It relaxes the smooth muscle in the prostate and the neck of the bladder, and that will help to improve urinary flow. All right. It can cause orthostatic hypotension. Now, you know what hypertension is. That's high blood pressure. Hypotension is low blood pressure. And orthostatic hypotension is when you stand up and your blood pressure drops. So it's that motion of going, you stand up and all of a sudden things are just getting dim. That's called orthostatic hypotension. And that can occur with this medication early on. So it's something to warn the patients about. Usually it's tolerated really well. We dispense this medication to most of our elderly male patients. Should be taken 30 minutes after the same meal every day. So dinner time, if you work in a hospital, they always do it at dinner time. Okay, so first time I saw a prescription, it came from the emergency room and it was for a woman. And I was kind of surprised. Why would a woman be getting Flomax? She doesn't have a prostate. And there was a little code on there for ICD-10. I plugged that into Google and found out that she had a kidney stone. And I'm like, that makes sense. And how did I not know this? So it's off-label use. They don't have FDA approval for it, but it works. So they usually send patients home with Flomax and Percocet. And that really seems to help with the pain and helps to relax the ureter so the kidney stone can pass, whether they're female or male. And that you will see quite a bit. Next up, we have Ativan. Ativan is another benzodiazepine, and the generic name is lorazepam. So it's going to have the same profile. It's going to get easier the last half of these drugs here because there's a lot of the drug classes being repeated. So, like clonazepam, this is a benzodiazepine and has some of the same, warnings. This has tablets. These tablets are very tiny, and they can be used sublingually. They'll melt in your mouth. They have a concentrate, which is like a little liquid. And what they do with that is they use that in cancer patients in end-of-life care to relax them. It's concentrated and it drops. They can put it in their mouth and not have to worry about the patient aspirating it. And it's a little bit nicer to not have to keep giving them injections. So, and the patients can do that. The patient's family can administer that at home. What I showed you a picture of here was the injectable for IM use. It comes this way, and it can be diluted further for IV use. And it is a refrigerated item, just like the concentrate. So if you have a hospice patient who's getting the concentrate, and you're going to have to educate the family that you need to keep the bottle in the refrigerator. Okay, so it has multiple routes. That's the point, what I wanted to share with you. All right, diagnosis, same as clonazepam, except that lorazepam only lasts about 4 to 6 hours, more like 6, where clonazepam is 6 to 8 hours. Clonazepam lasts longer. This one's a little bit shorter. This is used for anxiety disorders, insomnia, which is someone who just can't sleep, and status epilepticus. I can't say that word. I don't usually use that word, so I hope I said it right or good enough. And that's when a single seizure is lasting longer than 5 minutes, or seizures are going on, or that they're having 2 or more seizures occurring without the person actually fully regaining consciousness. So this would help with that. Oh, I forgot to tell you. I didn't put it on the slide here, but there's an Ativan. Oh, no, it's diazepam. They make it in a rectal gel because if a patient is thrashing around at home and you can't get an injection, you can't get anything in their mouth, they make this. It's not this one. I believe it's diazepam, and it's kind of like in this tube that looks like a syringe, but it's just a tube, and it's interesting. It's a rectal gel that you push the plunger in, and it will stop the seizure. I mean, you'll do anything, if you've got it. And we've dispensed it before for children. So the way it works is it enhances GABA, which the effects are in the brain, producing a calming effect. You can see the C4 here. All right, so it's going to be on the package, and it is Schedule 4. Box warning is a seizure risk with sudden withdrawal. And of course, it has addiction potential and has additive side effects with other CNS depressants. So more confusion, more sedation, more drowsiness, of course. More respiratory depression if you add this with any opioids. So that's would be super high risk. All right, next up we have Adderall. And Adderall is the brand name for amphetamine, dextroamphetamine salts. It's a lot of words. I look at this drug all day and I never say that. I still call it Adderall. I just say generic Adderall. And we hardly ever sell Adderall. But that's because the insurance companies would prefer to pay for the generics. But that is the full name. It has a combination of amphetamine, dextroamphetamine in the pill or in the capsule. Okay. So it's a CNS stimulant for ADHD and for narcolepsy. Not as common, but narcolepsy is when it's a condition where a person cannot stay awake all day and they've had plenty of sleep, and that's a medical condition that they have, and they just can't stay awake. In fact, they fall asleep very rapidly. So Adderall can worsen bipolar. So that is very important to know, because sometimes patients going to an ADHD clinic and they have a behavioral health specialist over here and they don't talk, and maybe the behavioral health specialist is not looking at the PMP because they don't think they need to, because they're not dispensing any controlled substances, or they're just not sharing records. So then they wonder, why is the behavioral health the patient like coming in and getting more and more agitated all the time. They have bipolar. They start changing the meds. It's just a cascade. It's a bunch of errors. The doctors, we all need to talk. So, and we all need to use one pharmacy too. So pharmacy and pharmacists can come in handy here, catching these kinds of interactions. So it comes in tablets, comes in capsules. And I want to tell you about the shortages in supply for just a moment. So during COVID, if you know anyone that's on this medication or you're on it yourself, during the pandemic, not because of the virus, but because of just everybody being at home. So children were at home doing school online. Parents were surprised for the first time to spend this much time with their children. Their child was trying to do academics. Well, it turned out that the diagnosis rate went way up. And that was the reason, the main reason that we now have more patients who are diagnosed. Therefore, we need more medicine. And so the medicine was thrusted into a shortage nationally. And that is due to more diagnosis. So it is Schedule 2. That means there's not going to be any refills. Doctor or provider would issue a new prescription every time. And refills would not be allowed either. So boxed warning, addiction, and also cardiac risks. Because it's a stimulant, it does stimulate the heart. So heart rate can go up, and there have been reports of patients having some terrible cardiac events. So they have to have close monitoring by their doctor or their provider. All right, so next we have Ritalin. Same profile. This is another, you can see the C2 here. And methylphenidate is the generic name. It is another CNS stimulant primarily used for ADHD and or narcolepsy. So you could go back a page. It's going to be all the same profile, all the same risks. Okay. It also comes in tablets, capsules that are sustained release and long acting. They actually call it Ritalin LA for long acting. And the CD, controlled delay. And I'll show you in a minute. It's crazy how many methylphenidates there are. So this is what I was able to find here. We've got Ritalin, the original. That would be methylphenidate, SR, LA, and here's the CD. I guess we don't have it under the name Ritalin, but we do have a metadate. These are all methylphenidates. And they have different, pharmaceutical technology behind them and how they release. And like this one, Concerta is great. It's a 12-hour osmotic release. You saw the video on the last video where we saw the video on osmotic release and what that does. And, they may end up, if I didn't say it earlier, with anytime there's an osmotic release mechanism in a pill, patient may end up with the little leftover pink part, the shell, in their stool. And a funny story, I had a patient came back one time many years ago, and he said, this medication doesn't work. It goes right through me. And it's because he saw the shell. And I looked up his profile and I said, you know what? That's supposed to happen. So, and I had to explain to him what an osmotic pump is. So Concerta has that, and that actually will let it work for 12 hours, it releases 12 hours. Amazing. Quilivant. This is a liquid, and it's also extended release. Pretty cool. And Quilichew, ER, is a long-acting and yet still chewable, some sort of waxy matrix that one's in. Daytrana, that's methylphenidate in a patch, and they can wear that for 9 hours. I've never seen this one up close. Eptensio, and has a dual phase release. Usually what dual phase release means is that it will release immediately, or part of it will, and then there's a delay release part in the other part of the tablet. And it makes sense so that they don't have to wait an hour or two for it to start working. So that's kind of cool. There's Journey, PM. You take it in the evening, and it starts working in the morning. That's clever. I have never seen Contempla XR ODT, but we can assume by that it's going to be long-acting and orally disintegrating tablets. Okay, so that's a lot. Moving right along, we are almost done here. We have Cymbalta, brand name for duloxetine. This is a long-acting capsule. It's an antidepressant in the serotonin and norepinephrine reuptake inhibitor family. All right, like all of the SSRIs and SNRIs, same profile, takes a while to work. By the way, it also takes a while to get out of the patient's system, but they should always taper off all antidepressants. Okay, it's important to know. Same box warning of increase in suicidal risks in teens and young adults. Paxil, another antidepressant, brand name for paroxetine. And this one's SSRI. It has the highest anticholinergic effects among SSRIs. So I'm going to tell you what anticholinergic effects are. Now you're going to read about that neurotransmitter, acetylcholine, and cholinergic means an anticholinergic. So I was in pharmacy school. They taught us this little mnemonic. It's very helpful. Never forgot it. It's been a long time. So if something is cholinergic, has a cholinergic effects, it has SLUD, S-L-U-D. And if it's anticholinergic, it's anti-SLUD. And it's great to know this. So if it has anticholinergic effects like this one, it's going to be anti-SLUD. So what is SLUD? S for salivation. So this being anticholinergic, anti-salivation would have possibly cause a dry mouth. L is for lacrimation. That's like your tears, so it could cause anti-lacrimation, anticholinergic effects, right? Dry eyes. U, S-L-U-D. That would be anti-urination. That would cause urinary retention. So you don't want to give this in someone that has a prostate issue, right? And D, defecation. So that's bowel movements. So it can cause constipation. Okay, but it has the highest amount of anti-SLUD effects among the SSRIs. Okay, so it's a little tip when you take one of your board exams and something comes up anticholinergic or has cholinergic effects, you just take off anti and you would be like, oh, that can cause runny eyes and could cause diarrhea. Okay, so you get the picture, right? Takes a couple weeks for effect and maybe longer, maybe a month to 2 months for the full effect. And we have suicidal risk in teens and young adults as the boxed warning. All right, a couple more. We have Nexium, and this is going to have the same profile as Prilosec, omeprazole. And this is an isomer of omeprazole. It's called esomeprazole. And it has that ending, prazole. It's a proton pump inhibitor, and it reduces stomach acid. So that would be for GERD, a hiatal hernia. It can be pretty painful. You don't want to have acid like just seeping up all the time. And H. pylori, which is an organism that some people have in their gut that is peptic ulcer disease, and just in general ulcers. So Nexium will help with all that. Okay, you can take it 30 minutes before eating, so that way it's on board and is in place before you have that first bite of food. When you start salivating and the acid starts surging into your stomach, it can't, because the Nexium's already working. And again, if you're going to keep your acid really down and your pH is going to really be up, minerals are not going to have an easy time to absorb. So it can be a problem, and patients should be on a multivitamin at some point in the day. Especially women should be taking calcium if they're on this medication, or any PPI, proton pump inhibitor. All right, last one, we've got naproxen. So I put 2 pictures up here because this is over the counter and prescription. And over the counter, naproxen will be found as naproxen sodium 200 120 milligrams. All right. Now you'll notice that the prescription one is 500 milligrams, but why isn't it 550? Well, we're not measuring the sodium. They didn't present it that way. If you take a leaf and you turn the package over, it's going to tell you how much naproxen and how much sodium is in there. They put the two weights together, and that's why they came up with 220. It's kind of confusing, but a lot of times they do that, and it's. I wish there was some sort of regulations that would enforce and mandate them to have some consistency in their labeling, but there is not. Anyhow, so this is an NSAID, non-steroidal anti-inflammatory drug, so it would be in the same family as ibuprofen. It's used for pain, fever, and inflammation, and it does last longer than ibuprofen. All right, so prescription, there's a bunch of them. So this one is naproxen, and you don't see this one every day, EC, enteric coated. And a naproxen enteric coated, we get that prescription every once in a while, and for some reason we just don't carry it, and maybe because we don't have anyone on it, and we call the doctor and they end up changing it. Enteric coated, though, is going to help the patient it's going to protect their stomach. It's going to dissolve the enteric coating. What it does is it actually delays the release long enough to pass the stomach, go into the duodenum, which is the next portion of the digestive tract, and it dissolves there. And so it doesn't dissolve in the stomach and it can't wreak any havoc. So it's really pretty smart, except that it's so expensive or not popular that we just don't have it. And then we have naproxen 500, which is just plain. It doesn't have the EC. And the other one is Anaprox. I believe I should have put a DS in there. Anaprox double strength is the 550. Okay, so there is a box warning you'll see when you look that one up. But interestingly enough, it's not on the OTC one. Why would that be? I think it's probably dose related. That's my best guess. Okay, so thank you for watching, and I'll see you in the next video. Oh, take it with food.